Welcome to Root Cause Medicine, presented by Spirit of Health, transforming lives through real health solutions.
Hopping and a popping, man.
Hey, Dr. Morse.
Hello, my friend.
Well, just to everyone out there, welcome back to Root Cause Medicine. And we have a special guest today, Dr. Robert Morse. Infamous to some people, probably still unknown to many others, right? But you've been doing this a long time. It's good to see you again.
Good to see you again, my friend. You look good.
Thank you. So do you. You actually look.
What have you been up to?
How old are you now?
73.
73.
Almost 74.
My dad's 71. So yeah. No, you look great. So I've met Dr. Morse down in Florida multiple times. I've been to your conferences. We actually did an interview together that's on YouTube a few years ago. We've been reselling using your herbal products for 7 years now, I think. So yeah, we sell a lot of your herbs, man. So yeah, I'm excited to talk to you and ask you a few questions.
Sure, absolutely.
So for those of you that, so for people who haven't, met you or seen you before, why don't you just give a brief intro of who you are and how you got into doing what you do?
Oh, Lord. Well, I started off, what was I, 21, went into the woods as a fruitarian, lived in a Volkswagen van and just ate fruit, but I was also an out-of-body traveler. So I was really into trying to find out who created all this stuff, right? So I went through all that and then came out of that and became a naturopath and an iridologist, herbalist, all that sort of thing, and just started teaching. Back in the day, and I lived in my clinics, lived in my vans and stuff like that because can't make it hardly. When you're trying to tell people that you can rebuild their bodies, they just have a hard time believing that.
Sure.
So it took me 50 years to build up enough evidence and proof, and now we pull people out of wheelchairs right and left. We rebuild all types of tissue, but it took a while for the public to catch on that. Right. I had to rub some noses with some more famous people and little things like that. And suddenly, I'm an old musician. So then I hit Def Leppard and Shania Twain and Mutt Lange. And, that took me off a lot more, too, because we all became good friends.
That's cool.
And then so there's just, people started knowing that and learning that they could get well. And our biggest thing is we teach the lymphatic system and how to clean it.
Right.
It's that simple.
That's great. So let me start by asking you a pretty pointed question, because I've known you for years. I know your belief system. And so I just want to right out of the gate, just get your thoughts on diet. And the reason I say that is because the diet part's huge for you and what you do. Mm-hmm. But obviously there's tens of thousands of people doing carnivore now. Mm-hmm. People are doing ketogenic diet. Yeah. I'm a naturopath, and I have to look at each person and decide what I think that person needs, depending on what's going on in their body. Mm-hmm. So, and I know you're pretty set on the all fruit thing. I guess I'm just curious, what you think about carnivore, keto, some of these other diets, because people are getting results out there. Is what you recommend necessarily for everyone, or does it depend on the person? Or do some people need a different diet first before they're ready for an all fruit diet? Kind of just give me your thoughts on that.
Okay. So let me start by saying that we're about 2 months away from a V-book on the Homo sapien as a frugivore. And we went back into anthropology 10 million years ago, and we've looked at the teeth and the guts, and we've got some top anthropologists talking about the Homo sapien as a frugivore, and then the fact that there's no adaptation to an omnivorish diet in all these 10 million years. And we have a lot of evidence to show that the Homo sapien is definitely a frugivore. With that said, though, to pull back to the last thing you were asking, this is all about an individual's state of consciousness or awareness. Some people just feel like they have to have meat and they're going to get better on it. And there's no such thing. If you're going to get better on something and you're down in the pits of hell and you eat raw meat, maybe you'll see a little bump, but I'm into regeneration of nerve tissue. And I see somebody out there making a claim of MS on meat. There's no way. I have had so many years at neurological regeneration. I can tell you that inside and out. And then Yale just came out and discovered, and I think you were on with that the brain converts glucose to fructose. Now that nailed down why we're getting nerve regeneration on fruit, but we don't see it on vegetables as much.
Okay.
So that's interesting, don't you think? That
is
the
interesting.
brain so why would you convert a simple sugar glucose to another simple sugar fructose if it wasn't more electrical or much more focused for neurons?
Right.
And that's what we look at.
Yeah. So that's interesting. So you, I don't know if you remember, but I'm a Christian, and I think back about like what you're saying about frugivore, the Garden of Eden. And, obviously our belief system on that's a little bit different, but, let's say God created the world 7,000 years ago, Adam and Eve in the Garden of Eden. Obviously they ate probably primarily fruit. I mean, that, there was no death, there was no killing, of animals. And so I think that was the original intention. So how that we were created for that. Yeah, I can see that. Now, of course, it is interesting that sin happened, men fell. Eventually, God did say, hey, it's okay to eat some of these meats because they're clean versus unclean, all of that. But I guess my question is, do you feel like some people do need a transitionary period?
Yes,
like they're so unhealthy, they're so chronically ill that maybe they eat paleo or something like that for a while, and then maybe they'll be ready for the more fruit later. I mean, what do you think?
Okay,
so we're trying to help people here, right? So we don't want people to get sick and not feel well on the fruit diet. So
so it depends upon the case. If you have a stat need, you got someone that has only a few weeks or a few months to live, who cares? You get them right on the fruit immediately. I'm pretty bad in that I tend to move you to an all fruit diet within a month. So what I do is I do fruit in the morning, a big salad for lunch, and maybe fruit at night. Or at lunch, you have a salad and some steamed vegetables or something like that. And that's what I also recommend after, because realistically, most humans can never become frugivores in this lifetime. So spiritually, they can't handle the energy. We talk about chemistry, and we can get into the chemistry and how fruits are much more chemically like mother's milk than, let's say, a dead animal piece of meat, that sort of thing, if you're looking at the chemistry of things. Right. But look at the electricity of things and the electrical side of this. And that's when you see the fruits of the highest electrical foods on the planet. Well, when you look at that, then you compare that to which system in the body has the highest need for electricity. It's a nervous system. But we take that further. If you look on our website, you'll see there was just a piece of tissue hanging on this guy's toe, right? I think you've seen that. And we just on a fruit diet, the body rebuilt that toe, nail and all. So it shows you that it is not just for neurons and the nervous system, that muscle, bone, connective tissue, tendon, everything else responds to the chemistry of fruit. Not saying that people can get there, because I agree with you 100%. You have so many people at all these different levels. Look at what happened recently with Hamas. That's a level. And, it's not and so you got all these levels of Homo sapiens on this planet. And so you do the best you can. But if you're asking if a meat diet I recommend that, not at all. The first thing I recommend is that you get off of all animal. Matter of fact, I highly recommend you get off of all acid ash foods that have an acid ash to it. Right. That way you're at least keeping your body halfway neutral and maybe even more hydrated. And so, or moving that way slowly even with cooked vegetables and steamed vegetables and stuff like that, and vegetables. But to say that having meat has any power to regenerate tissue or anything, that's not true at all. It's an acid ash food. So the problem with meat eating, it pulls calcium out of your body. And that's there's no good thing to say about that. You see that all the time. And so it would be better not even to go to beans or grains. These are all acid ash. I'd go to cooked vegetables and spices, that sort of thing, to kind of fit that need of cooked and maybe proteins and stuff like that. And if you can, I don't recommend nuts too much, but if you can, maybe trade some nuts for some proteins and stuff like that. But remember, if you're in pain, protein exacerbates pain.
Okay. So I know you've seen a lot over the years. So this would be a hard question for you to fully answer, but what serious chronic issues and what kind of things have you seen reversed using your program of, herbs and fruit?
Some of the worst cases, of course, are going to be quads and paraplegics. We had a guy, the parachute didn't open, so he was fractured up head to toe. Totally rebuilt him. I've had Lou Gehrig's to the point where they're and then opened them right up and got him walking. Tumor wise, I suppose the biggest tumor is going to be this one.
Wow. Is that in their stomach or?
Yeah, look at that tumor.
Is that a breast?
This tumor here, I pulled with black salve up on the top here. It's on the top of her breast.
Yeah. Oh, it's on her breast.
And
okay,
it started out like this. We put black salve on her and it popped. And then it became a like a piece of pie up here. I mean, this is necrosis. I mean, this is really bad.
Dang.
So I said, I couldn't get it off if they had a blood supply to that tumor.
Right.
I sent her to John Hopkins. And John Hopkins let her lay there for a whole week, telling her she's going to die. They have to cut her half her chest off and everything. I said, no, I pulled the tumor right on top. So her husband was going to take her out of there. They said, now this is John Hopkins. They got a breast surgeon in there. He snapped on gloves, picked up the tumor. She said the first time anybody ever touched her. And he said, oh, this is just on top. I can cut it off and save her breath. And that's just what they did.
Wow. That's amazing.
That's a pretty gnarly one.
Yeah. Well, I know you've seen a lot of other ones. I mean, you want to give us a couple more because you have some pretty amazing stories.
We have a lot of pictures. Some of them, some of the more advanced ones, it's really tough. I've just got so many pictures that, it's hard to say. Now, here's one I want to talk about because it's going around again. It's called the red ray, and it's like the ultraviolet red ray. And this is an example of what happens to a breast just with the red ray treatment. This is just a treatment. This isn't a breast with cancer. This is a red ray treatment. Look at this is the size of her breast before, and this is after the treatment of the red ray.
What do you mean by red ray? Are you talking like radiation?
Well, it's like the what's the a sauna that people do?
Far infrared sauna.
Yep, that's it. It's a far infrared treatment, and you see what happened? When you read the far infrared and you read the stats on it, my attorney gave me it, said, oh, you got to push this, I'm going, no. Radiation burns from the inside out. People don't understand that. So I'm reading through all this material and this scientific stuff, and it says it heats from the inside out. You never want to do that. By the time you see something on the outside, you've destroyed a whole bunch of cells.
Mm-hmm. So you worked with a lot of people with cancers and tumors and things like that, and you've seen a lot of that reversed, huh?
Tons of. Oh, I'll tell you this: we probably have a 93% success rate. There's probably 7% of the people that come in with. I've got it on my cell phone. I can't show you, but we've got one that's way out here in the jaw. She needs megatherapy really bad, and even that, she's showing teeth here, and I mean she's really bad. And so some of those, we have to step into nature and use nature. Well, try to get megatherapy in the world. It's really tough. So I told the practitioner, I said, I don't sit outside, let the flies get on her and, get in there, because that's the only way you're going to get rid of a tumor that is filling out your chin like this. And you got holes in, like I say, showing your teeth and stuff. You're going to have to use a little bit of nature's micro power and even the, like I say, the megatherapy. So
I'm a practitioner. I see a lot of people with a lot of fungus, mold, parasites. That's so common, and, you want to treat those things with herbs and different things. But what do you say to the people who feel like, you can't do fruit when you have a lot of mold and fungus and those kind of things in your body?
They've got to understand the fungal family. And the fungal family, I was just, we're putting together this 2 V-books. One's on man as a frugivore, but then we're putting the book on the great lymphatic system, a very in-depth look at your sewer system, immune system. So, excuse me, what was the question again?
Oh, just asking about if people have a lot of mold and fungus,
okay. So
and yeast and eating fruit.
If you're detoxifying, you do maybe like Parasitem or a little antifungal thing, they'll fall off, but you have to look at why you're getting molds on you. And this all goes to your adrenal glands and sugar metabolism. When you're not metabolizing sugar, guess who's going to come in and help you? Mm-hmm. And I will say also, though, that also goes to faulty food combinations. When you combine a protein and a starch, you're going to get fermentation and putrefaction both. So you're inviting bacterium, but you're also inviting the fungal family in. Anytime you ferment anything or you don't properly digest something, you're going to have help doing it,
right?
Like it or not. And the same with people, though, they eat so much complex sugar, sucrose, dyes and polys, and they just have these complex sugars. Well, man cannot metabolize these level of sugars, and so you're going to have help doing that. So You're going to invite the fungal people in, and there's no keeping them out. You have to learn that your terrain in your body is what your call to the wild.
So fruit, decomposes pretty quickly. You get fruit flies on fruit, things like that. You don't think people with really compromised digestive systems eat fruit and have some issues with putrefaction or bacteria from the fruit?
Oh, Lord, no bacteria from fruit. Bacterium's only after, it's the same thing going back and looking at Pasteur and Beckham, that sort of thing. These guys had no clue. They looked at on the outside coming in, and that's kind of like the misnomer that's out there, that these are creatures that come in to get you. They don't attack cells. They're after the sewage of the body. Like if you go to your lymph nodes and you look at the bacterium, they're after the acid ash or the acid waste from the byproducts of cells. Your macrophages are...
Yep. No, I definitely have seen that. I agree with that. So what else do people need? You're big on the diet. You're big on the herbal, support, but other people need other things. What else do people need? Sunshine, water, hot, cold therapy, like cold plunges are big these days. What else do you recommend to help people get well beyond just, your basics?
Sure. I love sunshine. I'm an outdoor guy, so I'm not an indoor behind the desk kind of guy. So I love sunshine. So if you can't handle it full on, if you're too acidic, because the sun is acidic, if you can't handle it full bore, get indirect, but it's full spectrum lighting. I don't recommend sun gazing. That is crazy stuff. I've had to repair a lot of damaged eyes and scarred eyes from that. You don't have to stare at the sun. Full spectrum will come in through you. You don't have to worry with that. Sure. Dry skin brushing is great. I'm an old Jensen fan with that, using enemas and colonics and things. If you use too many of those, you'll innervate your GI tract, and that's not what the goal is. Your goal is to eat electrical foods, which then transverses to the electrical system, and you have perfect peristalsis. Fix your kidney and adrenals. Fix what's going on with you. See, and that's the problem, is most people think there's nothing going on with them, and suddenly when they get something, they've caught something. What they don't realize, and very well, Lawrence, is that this is a development. This is a process of cheese and milk and dead animals and all this stuff like that. All this acid ash, all this mucosic response mucus, all this stuff that comes in the body. That's what you see the body getting rid of. Mm-hmm. Yeah. And you just got to step away from those foods temporarily.
Yeah.
You're like Dr. Oz. Dr. Oz took 12 people to the zoo, fed them like monkeys, and all their stats came down and everybody was happy.
Yeah. I remember that he wrote a huge book on nutrition.
Remember that?
Yeah. So what was I going to ask you? Sorry, I just lost my train of thought.
Well, I think people out there should understand that the body has a sewer system to it, and no one knows about it. and us naturopaths are the ones really putting attention on it and getting it out there so people understand that your blood isn't the only fluid in the body that handles you. Your handles the cells. That's your kitchen. Nobody poops in their kitchen. I've said this before. I'm an old home builder, custom home builder. I've never built a home without bathrooms. Your body has a major bathroom in it that's bigger than the kitchen. Totally. And when you learn how that thing really works and you learn what acids do to you, pretty soon you go, you know what? There is no such thing as diseases. You know what? I'm creating all this and I didn't realize it.
Right. Yeah. So what do you think about, people think alkalizing, they think greens and wheatgrass and, really green things. Are you on board with some of that too?
Well, I was. I used to, believe this or not, I've been through all this crap. I used to make wheatgrass juice for all my patients. Right. I did. And you come in, here's a glass of wheatgrass. But then again, I knew Ann Wigmore personally. I think I told you that. But I am more of an alfalfa guy. Shackley was alfalfa. He was farmer, I think. I'm farming. So alfalfa, to me, if you're going to do a green, more powerful, more mineralized, if like we had horses, I would never give horses wheatgrass. I would give them alfalfa grass.
Right. Mm-hmm. So what other ways do people get toxins and poisons out of their body? I mean, I just found people have a lot of congestion. They have gallstones, they have kidney stones. Yeah. When you have these deep levels of congestion, how do you get those things out? Do you do liver gallbladder flushes? Do you do some of those things?
Well, hydration is the only way to move it. Chemistry is how you create it, and chemistry is how you uncreate it. So you have to move into the electrical alkaline side of chemistry to hydrate. And as you hydrate, then you get fluidity, you get movement. And as you know, our whole gig is this: kidney filtration. Make sure that when you pee in a jar, you've got sediment in it. Because if your urine is clear, your sewer system isn't functioning properly. Right. Why would you have clear water coming out of a sewage system that is supposed to eliminate waste, particularly acids? That's why your urine should be slightly acidic.
Right.
If you have good bacterial action in your body, you'll have slightly acidic urine. If you use antibiotics and don't kill bacteria, you can really get into some UTIs and some heavy acid hits.
Sure. So speaking of acid, what do you think about, caffeine? Most of the world's addicted to caffeine. They're big on coffee. They feel like it helps them function and helps their brain work. I mean, where are you at on the whole caffeine thing?
I know we had a water delivery this morning, and he says, "You want any Red Bull?" I go, no, thanks. A lot of my friends are car salesmen and things like this, and they're sucking down Red Bull just to keep themselves going, and I say, one day you guys are going to come see me. You're going to have adrenal crashes. Kidneys are going to shut down. Your nervous systems are going to go, that's it. Yeah. And you can't stimulate. Matter of fact, when people realize this isn't about calories, this isn't about anything but pure energy. And when you remove the obstructions in your body, mucus, proteins, all the things we're talking about, and me and when you remove this out, when you remove the obstructions to the flow of energy, and you have 3 flows of energy in your body, blood, nerve, and lymph. Besides your own consciousness, those are the 3 main energy flows of the physical human body. When you remove all the obstructions to blood, nerve, and lymph, you can't believe where you're going. We have professional athletes that are breaking records all the time. I mean, it's amazing. Matter of fact, I had to actually step down. This is why I can answer your question well. I had to step down to a more balanced diet because I was out of the body all the time. And I know some people don't understand what that is, but basically you're not in your physical body, you're above it, or you're somewhere else going into another world or whatever. So it's crazy, but it's high energy. And for those that have no energy, turn on the energy, start eating it, fix your adrenal glands, get your kidneys filtering, and the next thing you know, you can't stand the energy you got.
So clearly a lot of people are going to argue, they're going to make the protein argument. Right? They're going to make the fact that, hey, you need protein. Protein's a building block. Protein is how you repair cells. Protein is how you build muscle. What's your thought process on the whole protein thing?
So I'm going to cover that in the V book on frugivore fruitarianism. But when you take a look at mother's milk, you're looking at about 7.5% carbon. you're looking at about 3.25%, maybe 3.5% lipids, and you're looking at 0.8 basically protein or amino acids. All right. So if in mother's milk and you're dealing in an infant and you think that you have to have all this protein, like some of these friggin' baby formulas have up as 20 to 25 grams of protein and 1 of sugar. That is so wrong. And that's why they're getting that NEC, the necrosis of the bowels. You can't eat an acid ash food, even as babies, and not lose your GI tract. So that's the problem, is that these are acid ash foods. So I also forget where I was.
You mentioned athletes. So you have athletes. How could a pro football player or, a high level athlete that has lots of muscle, have you actually seen and experienced that high level athletes can sustain their muscle and their strength?
Not all on fruit. I've never seen anybody take it to that level. I've seen them where they went. I've seen a lot of pro athletes and bodybuilders in particular go all the way to detoxing on a fruit diet and then come back to adding greens because they want to keep bigger, bulky muscles. The importance of doing it with greens, though, is the difference between acidifying your body and alkalizing your body.
Right.
Your body can't use protein anyway. So when you look at protein digestion, it becomes quite obvious that the only thing you need is amino acids. And part of what this B book is on it, we're getting into the acid levels of stomachs of all the vertebrates. We're getting into the needs of a fruitarian diet. Do you use stomach acid when you eat fruit? We're into a very detailed look at the human anatomy and physiology as it relates to diet. So I think you'll really like that when it's done. And it'll be all on video. It'll be a video book. And it's an in-depth look at the anatomy, physiology of the Homo sapien and anthropology, all the facts that we know,
So you're basically saying people can get their protein from greens and other plant foods, alfalfa, things like that.
Well, as a naturopath, one of the classic responses to that is, how does a horse get his protein?
Right. Sure.
And strong
muscles.
Exactly. Same with cows, same with all these sort of things. We can get into that sort of information.
They're also in the sun all day and we're not, right?
Exactly. So I think man has this misconception, and of course he's already built. And so the need of amino acids is minimal. And so when you look at fruit, they have a more simpler amino acid structure. We feel there's very little, if no, stomach acid required. And the same thing with vegetable matter, because you've got alkaline enzymes, then you go to an acid pouch, and then within a few inches, you got to bring that pH back up to 7, 7.5 if you're going to turn trypsin or chymotrypsin, which takes polypeptides and breaks them down to amino acids. But to do that from the protein, you're taking a stomach acid of 1.8 and you've got to move it to 7 within a few inches. So your life is better when you don't eat foods that require that sort of shift in pHs.
Yeah, right. So you mentioned high energy foods, and you've been doing this for a while. So what would you, I don't know if you tested or how but what are the highest energy, quote unquote, what are the highest energetic foods? And obviously some stuff is compromised with herbicides and pesticides and our world and, pollution and all that. But what do you find the highest energetic foods?
Watery ones.
Okay.
Like oranges and things like that really get the good sun. That's the other positive thing about the fruits and the veggies, all the sun, all the photosynthesis, just everything. But the fruit side of that is like a gift to man. And there's a lot of people on all kinds of levels, from Christianity to Buddhism to Hinduism. Some don't want to step on grass. They're afraid to hurt something. So you have all levels of thinkers out there in that respect. So in that respect, we're even covering clinical practice of using fruit. We're covering environmental effects of using a tree-driven diet as opposed to a gardened, because that's another thing is you have to tear up the ground. You have to some way of some type of even organic fertilizing and stuff where a tree really gives back to itself. So there's so many, and the yield per acre on a tree yield as opposed to a garden yield is tremendous. And then of course, if you go to the animal yield, you're way down to nothing. So, in those sort of things, but then you have the environments wanting to get rid of all the cows. So
So what is unique about your herbs, your herbal products, your herbal formulas? What makes them better than other ones out there?
Well, I use a 1 to 4. I also, when we make them, we put them all together. We don't, a lot of in the older days, if you wanted a formula made, you already had your single herbs made. You just however minutes you wanted for each one in there. I like to macerate it all together.
Mm-hmm.
Also, it's about which herbs go together. You have to really. I've taught herbology since I was 21, 22, and I've taught with chiropractors. We taught courses for a long time. And so I would take 10 herbs and I'd hand it to my students and I'd say, learn those 10 herbs, then I'm going to give you 10 more. And then I'm going to give you 10 more till you go about 100 herbs in your repertoire of understanding what these herbs are for. And it's easy to do that because some herbs are so common. It's like, I'll give you an example, burdock root. I can't imagine anything burdock root isn't good for. Tumors, blood. I mean, you can just keep on going down that line. And some of the herbs are so beautiful, but you got to know which herbs like each other and which herbs don't. And that's the secret. Your percentages and, some herbs just don't buddy up.
Gotcha. And then don't you guys use a big press or something to really get a concentrated
110,000 pound press?
That's pretty impressive.
Yeah, a press is I think your press is important too. Some of these people have 15,000, 20,000 pound presses. Going up to your 2-ton presses or so. And you really can, basically there's not much left.
Right.
And you might get some bottles. Some people get bottles with some herbs still in there. And they bitch go, oh, look, no, those are the ones you want. Those are the nectar of the gods. That's like the most powerful part of it.
Yeah. Okay. So people live in different regions. I live in Kansas City. We have different seasons. It's hard. It's hard for people to eat fruit in the winter when it's 5 degrees outside and it's snowing. And so, what do you suggest? People eat, kind of a mixed diet during the winter and then go for it in the summer. I've also noticed that I feel like a lot of the fruitarians, so to speak, all seem to live in these nice, warm, tropical environments.
Well,
they live in Florida like you, they live in Hawaii, they live in, but you don't hear people in Fargo, North Dakota a lot talking about fruit diets, right?
And you're right on with that. And I have to say that I think this is when Homo sapiens started migrating to different places. Remember, the land masses were different then. So when you're in a cold climate, you're in an alkaline climate. You do not desire alkaline food. When it's cold out, you want to warm up. When it's warm out, you want to cool down. But that's how nature is. Man is a tropical species and a subtropical at best. Outside of that, man struggles in these environments. Well, take a look. Here's a good example. Take a look at a typical Alaskan, a native. Okay. And then take a look at, say, a native from one of the islands. You're an Alaskan about 70 years old. You look about 90. I've seen them out there at 50 years old, and I thought they were 70. When I look at their teeth and I look at everything about them, when you're eating that much protein, you're going to lose calcium. You're going to start seeing structural issues, and that's just what you see. When you go over to the island, and I've had them in my clinic, over 100 years old, and it's like raised on fruit diets. And this is the thing, it would be good conversation. Get some islanders that were raised on fruit and listen to their stories. It is friggin' amazing that they never had any childhood anything until they started eating more civilized Americano food.
Right.
So you've got there's an island with I think everybody on it's 120. So I mean that you can look at diets and compare. Now the China study is a small example of that study, but I think you can get deeper than the China study and really look at some of these the fruit level of where they're at. And I've had them. I've talked to them. One lady was 96 and she said, I never was sick. I never had any problems. I have all my teeth. And I mean, she's 96 and I keep asking her, I said, your skin looks like you're 16. She said, I was raised on fruit.
Wow.
She didn't know how powerful her statement was.
Yeah. But you're saying even if you're not an islander, you can do that wherever you live.
Yeah. You know what? If you're trying to do it in the cold, wrap up.
Right.
Get blankets, wear heavy wraps. If you want to balance out, then have warm soups. Like when I had a clinic in Portugal, and they used to fix us like carrot soup and some warm soups and stuff like that.
So you hit on something that I want to mention. I think it just triggered something in me because I know cold therapy's super popular these days. I've been doing a cold plunge in my backyard really consistently now for a month. And I notice that something's changing in my body, and I'm noticing like mucus come up and come out. And you made the statement that cold is alkaline. So to me, that would make sense, is what you're saying is alkaline cleanses, heals, detoxes the body. Cold plunges are popular and they're working because they're alkalizing the system, therefore promoting detox, right?
Right. Well, look at the wintertime. That's when all the cold and flus came.
Everybody gets sick in the winter.
Everybody gets sick because
they're detoxing, not because some virus is attacking them.
Nope, not at all.
There you go.
Some guy was delivering something at my house, and he was talking about he just came out of COVID and stuff like that. And I said, "You did, huh? Explain to me." He said, "Well, I was up in this cold part of the world somewhere, and it was cold, and I was all wet." And he went on and on and on and on and on. I'm going, "You just tripped yourself into a cold and flu-like symptom, son. Right. It isn't you didn't catch anything. You drink milk, you do all these things, and then you get in real cold. You're going to trip you into a detoxification. That's what alkaline does." And I've said this for years. It's either your food, your weather. Whenever you're alkaline, you're gonna move your body more into a hydrated, detoxifying state. Because acids are heat producing. They're hot.
Right.
People can be cold and burning up at the same time.
Yeah. So since it's so crucially important, and since it's not talked about near enough, tell us why the lymphatic system is so crucial to our health.
Oh Lord. Us naturopaths need to make that claim and hold on to that, because the medical profession is so slow at understanding that system. The medical profession thinks the body dumps all the waste from your cells, and you have a roughly 70 trillion to 100 trillion cells. When I went to school, it was 70 trillion. Now I heard it's 100, who knows? But you're up to a lot of cells. So every cell in your body is a little person. It eats and it eliminates waste.
Right.
So the question is, where does your body remove all these wastes? And these wastes are acids for the most part. When you look at the Krebs cycle and you look at all the byproducts of metabolism and everything else, you're looking at acid waste. So these acids have to be eliminated, or you see the word inflammation, right? So How does the body get rid of acids? Well, the medical doctors think you'd poop in your kitchen. You dump your waste right back into the venous system in the inferior vena cava. How stupid. You cannot do that. You have a whole system, and it's its own system. The lymph system is not part of the blood. It is its own system. It includes the kidneys, the spleen, the skin, the thyroid, the adrenal glands. This is all part of your system, because your body is simply a food processor. First of all, you got to digest. Second of all, you got to absorb. Third of all, you got to utilize what you absorb. And fourth, if you don't eliminate the byproducts from that, they stay at home. Now you got inflammation. They stay at home too long, you got cysts and tumors.
Wow.
And the kidneys are your main eliminative organs to this waste. And that's why you need to see sediment in your urine. Your skin also. Why do you sweat? And when you don't eliminate well from the skin, what do you see? Acne, psoriasis, all the acids building up subcutaneously and below. And It's just not the ability to eliminate. So we as naturopaths are showing the world, first of all, your consumption's way off. And third of all, none of you're eliminating well, because your consumption swelled up your kidneys and broke your kidneys down. Now you've got all the symptoms of kidney problems, your lower backs, you've got, all your cysts, your tumors, you got all these things in you, and it's all kidney problems. And then it becomes the adrenal glands, they bring them down. And then pretty soon, that's the autonomic nervous system, brings that down. Then your sugar metabolism comes down. Then you get high blood pressure from kidney weakness. And then all your sugar, then your diabetes from your sugar metabolism. And it just goes on and on and on. And it's simply your lymphatic system not being able to be drained properly. And your body's...
I was going to say, and you say what reverses that primarily is chemistry.
Chemistry.
And it's alkaline.
Yep. Alkalinity and astringents. So that's why we go to the fruits. When we go to the high electricity, we go to the high alkalinity, and then we go to the astringent part, because you have to have some astringent, because you have stagnation, you have agglomulation. Look up the word cationic and see what it means. And when you see agglomulation, look at a lake that's stagnant. It's just sitting there. Water's just sitting there. What is the first thing you see on a lake that's just sitting there? Palm scum. Exactly. Fungus. And that's why you see so many people so full of fungus, but also bacterium, because their sewer systems are backed up head to toe.
Right. So if alkaline's the key, what else is alkaline? You got fruit. We talked about cold.
Vegetables.
Vegetables.
Vegetables are pretty
How about breath, breathing, oxygen?
Well, that's another great important thing. When you were asking me before, I was thinking people have to learn how to breathe abdominally instead of thoracically. Most people just breathe up here, right? You've got to breathe down here. And I tell people to practice, put your hand on your tummy, on your abdomen, and practice breathing in and out and moving your hand up and down, right? So breathe in, and then take another breath, but lift your shoulders and do it in the upper lungs. So now you've filled your lower lungs and your upper lungs. You've got to feed your lower lungs. Thoracic only breathes upper lungs. Abdominally breathes lower lungs. And that's where all the wet, all that gets down in these lower lobes. Yeah.
I have to say, I've been doing the cold plunges. I've been doing the Wim Hof, breathing technique every morning pretty consistently. It's changing my body chemistry. I am seeing things change. It's really cool, man.
Yeah. So, I think anything that helps us like that, breathing, also positivity, learning how to get a hold of your thoughts, because thoughts can take you down a bad road. So getting a hold of the mind is important. And we teaching people how to get in the now. How do you live in the present moment where you can be happy when you were a little kid, and playing and your parents said, come in. You know what? I mean, there was no time. And that's what people have to get to again, where there's no time in their world. Their world will keep on going, but they'll free from that mind. And that mind is the joker of all jokers.
Yes. It's the battle within us, right?
Yep.
All right. Well, let's leave with this, if you could, Dr. Morse, just because you've worked with so many people, you've been doing it so many years. Thank you for all, the work you've done and all the people you've helped. Just speaking to, our audience, and let's say somebody pops on here and they're chronically ill. What's your message to them to give them hope and help them believe that they can get well?
Well, I think listening to your podcasts and stuff, getting a hold of our videos, it's drmorse.tv, getting there and looking at that. If you got we have a school, you can go to our school. I teach you the physics and chemistry of this, but real simple, because I've learned years ago to take the complex and make it simple, because you can't get too complex with people. They don't understand anything. So keeping it simple and understanding you have a sewer system in your body, it's called your main immune system, and how that works. You start to learn things you never knew before that's not in the textbooks yet, things that we've discovered that's coming. And it's just a cool thing. But immediately the first thing, if you're suffering, you got to change your diet. If you're suffering, you've got to change your diet now. We recommend grapes. Just jump on grapes. If you want to do grapes in the morning, a salad at lunch, maybe grapes at night, however, but move to a raw food diet. In other words, get rid of the cooked food. Get rid of all your cooked food and eat everything raw. Okay. All raw vegetables, raw fruit, raw berries, melons, things like that. Then if you have a little money, go after your kidneys, go after your endocrinology in your body, vital, because so many people have the pituitary problems, and you've seen us, we're talking about the parathyroids and calcium. They're depressed. They have skeletal problems. They have connective tissue problems. They have varicose veins, bruising. They have aneurysms, hemorrhoids. So there's a lot people can learn to rebuild their body. And I might suggest that learn some iridology. Learn the eye. Naturopaths teach the eye. And the eye has your whole body in it. It has every cell. It has your electrical system in it. It has your circulation in it. But most importantly, you can see your lymphatic system in your eye. And no other science on this planet has that.
Yeah, that's true. You mentioned grapes, and I remember I read that book, The Grape Cure. I'm sure you've read that book, but it was an interesting story that this gal cured herself of, I think it was breast cancer, it was some type of a cancer. And she was so excited about it. I think she lived in England, somewhere in Europe. She was so excited about it. She thought she'd bring the book and not the book, but she thought she'd bring her ideas and her grape cure to America, and everyone would just jump on it and cure themselves of illness. And obviously they wanted nothing to do with it. They didn't want to hear anything she had to say. I mean, this was early 1900s. So it's amazing how ingrained our medical system is in their philosophies and their mindsets, even over 100 years ago when this grape cure book came out.
Well, she was fighting your Rockefellers and your, that whole move to make the germ theory a reality, past years ignorance, and try to bring the disease theory of Jenner in. That way, they set that up and people can got, the microscope freaks, stuff like that. And so that nailed down the worst type of illusion possible, that man's fighting external problems and that nothing he's doing is contributing to it. Yeah. And that's like there's nothing any more stupid to think that the chemistry you're playing with in your world, in other words, what you eat, what you drink, what you breathe, what you put on your skin, is not affecting your world. You gotta rethink.
Yeah. And all the more important these days, we take personal responsibility and stop blaming everything else, right?
Yeah, absolutely. You have to do that. One man once said, I like what you're saying. You got a good reputation. He says, you have prostate cancer. And he says, I'm going to put my life in your hands. And I looked at him and I said, no, you're not. No, I'm not. I didn't create your problem. You did. I will help you through it because we've done thousands of them. But you created it. You're going to ride the ride and you take full responsibility.
Well, the Greek root word for doctor actually means teacher. So we're supposed to teach people, right? Yeah. That's what you do.
Yeah. So, way showers. I call us way showers because you don't want anybody to walk your walk, because no true master will walk your walk. You have to walk your walk. And if you don't walk your walk, you will. Because I believe in some things and like cycles of life, kind of. So get it right the first time if you can.
Right. Well, thank you, Dr. Morse. I always appreciate your time and talking to you. Thank you for all the people you've helped over the years. Definitely give some people some things to think about and some hope for those who aren't.
Always have hope. Like I said, out of 100 people that have anything you could name, especially cancers and tumors, we get about 93 to 95 of them walking home free. The opposite is medical. Of 100 people that go on chemotherapy, only about 10 walk out alive.
It's crazy.
So, it is crazy. I love you. Take care, my friend. It was
bless you, brother.
My friend.
Great to see you.